Good evening. I am Virginia Harris, the immediate past national president and the executive director of the National Coalition of 100 Black Women Incorporated. It is my privilege and honor to introduce the 10th national president of the 100 Black Women Incorporated, Elizabeth A. Jones, an Ohio native. President Jones is recognized in her community as a respected, prominent thought leader and visionary. She holds a master's degree in business administration and accounting. Private, public, and nonprofit experience is what she brings to the table for NCBW. President Jones is the principal owner and CEO of her own private accounting firm that is very successful in Ohio. President Jones enjoys reading, gardening, and spending time with family. I present to you the National President of 100 Black Women Incorporated, Elizabeth A. Jones.
Good evening, everyone. It is my honor to bring greetings on behalf of the National Directorate and all the activist women in our 61 chapters and 26 states that comprise the National Coalition of 100 Black Women Incorporated. The organization was founded in 1981 in New York City and is a 41-year-old advocacy organization whose vision is that Black women and girls will live in a world where social, economic inequity does not exist. NCBW has partnered with Walgreens for a national campaign and webinar about the importance of respiratory syncytial virus, better known as RSV, and pneumococcal vaccines as a preventative healthcare measure that substantially reduces the burden of both diseases in vaccinated individuals and the population. The panel will review the types of pneumococcal and RSV vaccines, indications and approaches to vaccine selection, the safety of vaccination, and the rationale for vaccination. Preventative healthcare measures are vital to a thriving, healthy community. It is time for us to take charge of our community and take control of our health. Thank you. Thank you again for tuning in, and I now turn the program back to Executive Director Harris.
It is my pleasure to introduce our facilitator for the evening. Dr. Kimberly Jeffries Leonard is a member of the ACS-CAN Board of Directors. She served as the 17th National President of the Links Incorporated and the Links Foundation Incorporated. Dr. Jeffrey Leonard is President and CEO of Envision Consulting, LLC, a boutique public health consulting firm, specializing in strategic and innovative executive level solutions for public, private, and government entities, program design and implementation, and program system assessment and evaluation. Dr. Jeffrey's broad background includes expertise in developing, implementing, and evaluating and guiding public health and behavioral health programs, policy, and related legislation. She is a subject matter expert in minority health, HIV/AIDS, substance abuse, health disparity, co-occurring mental health and trauma, and women and adolescent services. She is an honorary member of the National Coalition of 100 Black Women and a friend. Thank you so much for facilitating this very important conversation this evening, Dr. Leonard.
Thank you so much, Executive Director Harris and Madam President. It is my honor to be here with you all tonight to moderate these very important discussions with these very renowned experts on these panels. So without any further ado, for our first panel discussion for the pneumococcal vaccine, I'd like to introduce our distinguished panel. First, we have Simy Casasola, who is the healthcare supervisor at Walgreens Company. She has been a pharmacist for over 15 years, and she is passionate about helping patients, community, and others with various healthcare needs. As a healthcare supervisor at Walgreens, she supports and collaborates with various leaders, including community leaders, to drive various immunizations, embracing health equity, and providing the best patient care to our communities. Next, we have Dr. Danielle Nwigwe. She is a pharmacy manager at Walgreens Company, and she's a manager in Inglewood, California, and a graduate from Xavier University of Louisiana College of Pharmacy. She is also passionate about patient wellness and safety, community outreach events, and collaborative care with other healthcare professionals. Our third panelist tonight is Dr. Patricia Marsh. She is the CEO and co-founder of Ask Me Your MD Incorporated. Dr. Marsh uses her role as the CEO and co-founder of Ask Me Your MD Incorporated to decrease physician burnout by providing a fully remote PRN telechat solution. Welcome to our distinguished panel. So we're going to get started, and we're going to ask the very basic question first to Dr. Marsh. What is pneumonia?
So that's where we have to start this conversation. And simply put, pneumonia is an infection inside of the lungs, and it can be caused by bacteria or viruses that get into our bodies. And we'll talk a little bit more about how that happens. But basically, it starts our body's reaction to fight off the virus and the bacteria, but it causes a little bit of trouble for us because we end up making mucus and fluid in the lungs and in our nose and sinus passages, which some of us are experiencing right now with this weather change. But that's simply put, pneumonia being the infection inside of the lungs.
Okay, that's very helpful. So that kind of sets the baseline for us. So tell us about the pneumococcal pneumonia vaccine and how it works to prevent pneumonia.
So, and this is so key. Dr. Nwigwe will talk about the different types of the vaccines because there are a few different types of pneumococcal vaccines, but getting back to the basics of what pneumococcal pneumonia is, it's actually caused by a bacteria called Streptococcus pneumoniae. And basically, this can get transmitted from one person to another in droplet forms of sneezing, coughing, and without good hand washing and cleanliness, we could pass it on to each other. That's why we see it going up in the fall, because kids go back to school, a lot more people are gathered in central environments in the inside. And so we see the rates of the pneumococcal pneumonia going up. Yeah.
So you said some really key things there. Kids going back to school and passing it on, washing our hands. I think those are things that we hear about a lot of viruses. So tell me and tell us who is recommended for the pneumococcal pneumonia vaccine and exactly why.
So the pneumococcal pneumonia vaccine is recommended for quite a few ages. And the reason being is because it accounts for more than 50% of pneumonia in the country. I want to repeat that. Pneumococcal pneumonia accounts for more than 50% of pneumonia in the United States. And so it's very, very important that we protect ourselves against this pneumonia. But we have certain ages that we see they do worse. And those ages are 2 months old, 6 months old. So your babies, anybody less than 1 year old, we have to protect them. And then as we become toddlers in the ages 2 to 6, we see that we want to keep them protected. And then once you go into your teen years, your immune system's a little bit more mature. We recommend it for 19 years old and older if you have certain conditions that would make you more likely to be infected in a severe manner.
That was very helpful. So that leads me into the next question, which I'm sure, Dr. Nwigwe, you get all the time as a pharmacist. Are there different types of the pneumococcal pneumonia vaccines? How many? And if so, how do they differ?
That's a great question. And yes, I do get it all the time in the community setting. At this time, there are currently 2 pneumococcal vaccinations in the United States. Between those 2, they go into 2 separate groups. The first group is pneumococcal conjugate vaccinations, which are Prevnar 13, Prevnar 20, and Vacuvance, which covers 15 strands. Then the second group, which is the one that's been around for a while, which is the polysaccharide pneumonia vaccination, and that was Pneumovax 23.
You know, that's helpful because we see those commercials a lot with these different names. And as you were giving the names, I'm like, oh, I remember hearing that name on the commercial. So thank you. So now that we know that there are 2, how effective are these vaccines in preventing pneumonia? And does it protect against all of the different types of pneumonia that we've heard about so far?
So like Dr. Marsh stated, there is currently, it's a pneumonia bacteria. So there are about 90 strands of pneumonia out there, but these vaccines cover about 24 of those strands. So there's no true 100% coverage, but like many vaccines, you just want to make sure you protect yourself, and it's better to be protected than to not be protected with the vaccination.
Can you say that one more time, please?
Like, it's better to be protected versus not be protected with the vaccination.
Thank you. I think all of us on this panel want to make sure that our audience really hears that. Please get vaccinated. It's better to be protected than not be protected. So since we know it's better to be protected, we know there are a lot of myths out there about side effects. We see a lot of these theories going around. Can you tell us what the side effects of the pneumococcal pneumonia vaccine are, if any, and how common are they?
So side effects are significantly common with all vaccinations. So for the pneumococcal vaccines, both categories, you can experience local site reaction, redness, pain, tenderness, feeling tired or fever, or like muscle joints or muscle pain, muscle aches or joints and pains. But in particular with the pneumococcal conjugate vaccination, which is the newer one that's televised, that one has an added side effects into what I just said, which was loss of appetite, feeling irritable or fussiness, and chills and or headache with the newer versions. But the newer versions are, I would say that they're the better ones to get at this time because of the way that the vaccine travels into your system. It increases your immunity and coverage for the vaccine. So in most cases, the Prevnar 20, which is seen all over television right now, that is the standard right now to get that one for sure.
How long do these symptoms last, these side effects last?
No more than 2 or 3 days. If it's greater than that, then you would want to see your doctor. But most cases, when your pharmacist gives you your vaccination, we'll explain to you that the local site reaction might be tender or sore. But like most people, they could pre-medicate with like Tylenol and or Benadryl if they're known to having side effects to vaccines. But it's pretty common, and it's just most people don't even feel it when they get the shot. So they just, because our needle is pretty thin that we use now. So it's a quick and easy process when you do come in for your vaccine.
I can attest to that. It is very quick, and it is a thin needle. I'm the worst patient, so I'm embarrassing myself every time I go in and see a needle. Simy, tell us, are these a one and done vaccine? How often do we have to get them to stay protected?
This totally varied based on the age and health conditions. Dr. Marsh just mentioned who's actually eligible for the vaccines, and also the type of pneumococcal vaccine you have previously received. So it can varies, depends on each person.
Can individuals get pneumonia even after receiving the pneumococcal vaccine?
You know, that is the best and the greatest question. We get that all the time. So yes, infection is still a possibility. You heard Danielle and Dr. Marsh mention that there are 90 strains of, strains are out there, but only 24 are protected with the vaccine. So infections are still a possibility, but the symptoms of the illness of those vaccinated tend to be less severe. So it is still recommended, just like Danielle said, it's much better to be protected than not protected.
I'll ask you to say that one again too.
Yes, it's absolutely important that everyone understand the importance of the vaccine, and it's much better to be protected than not protected.
Is there anyone who should not get the pneumococcal pneumonia vaccine? And if so, why should they not?
Yeah, there are people with allergies to vaccine or some components of the vaccine. So they should definitely not receive the pneumococcal vaccine. And children younger than 2 years old should not receive the polysaccharide vaccine, the Pneumovax 23. And anyone younger than 19 years old should not be receiving the Prevnar 20 vaccine. The best way to find out which vaccine is best for you is talk to your doctor or your local pharmacist. We are there to support for our patients and the community to educate them which vaccine is the best for them. So make sure that you come and talk to us.
I think that people will start making sure that they do that. But before we close, I have one last question for you. How does the pneumococcal pneumonia vaccine compare to other preventive measures such as antibiotics or antiviral medications?
Yeah. Like I mentioned, infection is still a possibility, right? Even though you receive that pneumococcal vaccine. So it is recommended that people should continue practicing the good hygiene to reduce the risk of infection. So we still need to practice the good hygiene, washing our hands, covering when we are sneezing and coughing. But the good hygiene is extremely important to prevent getting this disease.
You know, you all have given us some really excellent information, especially in light of the fact that it is pneumonia season. So we have a little bit of time for some Q&A. So I think that there are a few questions in the chat, in the Q&A and in the chat. So the first question, are there any long-term side effects of the vaccines, these two vaccines?
I'll answer. Hello. Currently at this time, there isn't any long-term side effects of the vaccine. So there hasn't been any studies or anything reported of anybody suffering any type of long-term effects. Everything is short-term, and unless it's like something where the needle stick, like if the way they injected it, like that's the only type of reaction that would be long-term for individuals. Other than that, the vaccine is doing its thing, building the antibodies and protecting you. That's the long-term effect.
Okay, and one of our participants has said that she received it and the only side effect she received was a soreness in her arm. There's another question. How long do the vaccines last?
So with the pneumococcal vaccination, it's preferred if you are a healthy individual with no immunocompromised issues or any type of health condition that your doctor deems necessary. One pneumonia vaccination is good enough unless recommended by your doctor to get another one in 5 years. Then in 5 years, you would need to get another dose because of your immunocompromised condition being cancer, rheumatoid arthritis, sickle cell, lupus, anything like that. Your doctor would recommend that you get a routine pneumonia shot, which is about every 5 years. If you the older one, which is Pneumovax 23, which I'm pretty sure a lot of people have received, it's important that you get one of the newer vaccinations to get greater immunity and coverage. So therefore, if you received Pneumovax 23 last year, so you have to wait at least 1 year before you can get the newer vaccine, which is the Prevnar 20, Prevnar 13, or Vacuvance.
Okay.
I just want to add a couple of other conditions that we physicians definitely want to put out there. Asthma, COPD, diabetes, heart disease, and cigarette smokers. These are 5 of the top chronic health conditions for which we absolutely recommend an annual pneumococcal vaccine for. I get mine every year as an asthmatic. Craziness in Georgia with the season changes. So I absolutely recommend that to my patients for sure.
Dr. Marsh, can you repeat those conditions again where if you have one of these, you should get them every year?
Absolutely. So there's asthma, there's COPD, there's diabetes, heart disease, and if you're a cigarette smoker, that's added to the immunocompromised state, as Dr. Nwigwe said. If you are on chemotherapy, or if you have sickle cell disease, because a lot of these patients don't have their spleen, which helps to fight off these infections. And so we have to protect anybody whose immune system has been compromised, HIV, yeah, in those cases.
What about senior citizens? Do we want to make sure, are they more likely to need to get the vaccine than other ages?
Absolutely. And that's what we're seeing. The very youngest of us and the very oldest of us have the highest hospitalization rates in the United States. And so we want all adults 65 and older, you definitely should get your pneumococcal vaccine.
Is there a particular one that is recommended for people over 65?
Yeah, I can answer to that. With the recent recommendation, Prevnar 20 just added recommended for everyone who's over 65. So one dose of the Prevnar 20 alone can protect all eligible adult patient. We do get a lot of questions in the pharmacy that they already previously received, whether it's a Pneumovax 23, they were 65 at the time, or they received a Prevnar 13. Now they are 70 or 68 or 69. Should they get Prevnar 20? Yes, it is now recommended for everyone over 65 should get one dose of that Prevnar 20 to get protected.
We have time for just a few more questions. There are a couple that I want to bring to your attention. As you all are keeping us healthier, we're living longer. Should people over the age of 95 continue to get these vaccines?
Of course.
Yes,
Absolutely.
Okay. So all ages is important, and especially once you hit that certain age, you should definitely make sure that you get them. There was another question that I wanted to ask, that I wanted to make sure we got to in the chat. We talked about the ages, we talked about the vaccines. Now there's one of our participants who was saying that she had taken the first of the 2 vaccine series and she got very sick, but she was hesitant. Now, because of her reaction, she's hesitant to take the other. What do you recommend?
I probably can answer, just to talk to their pharmacist or the doctor, right? What kind of reactions they had, how they got sick, and they can definitely identify that if they are eligible to receive the new vaccine or another dose of the vaccine. It's that conversation is the key. Sometimes it's just the side effects. Someone have that a little longer, but just talking to them, and we will be able to identify that if they should be receiving another dose of the vaccine or the another vaccine.
What is the cost of the vaccine, and are they covered by insurance?
Great news. Yes. The pneumonia vaccine is covered through Medicare Part B. If they're over 65, eligible for Medicare 100%. And if they are commercially insured patients, most of the vaccines are covered at your doctor's office or at your pharmacy. So yes, absolutely, it is covered through your insurance. It's considered one of the preventative measure. So we highly recommend everyone to come to talk to your pharmacist or the doctor to receive the vaccine.
So our last question. Oh, I'm sorry. Go ahead,
I was just going to throw out there, should you not be insured or not be eligible, or want to know like the base cost, it's usually like $120 to $150 out of pocket.
Okay. And our last question, this is COVID. We're still having, people are still having episodes of COVID, and we're still asking people to get vaccinated if they haven't done so already. If they have, get boosted. We have one question that Ms. Morris is saying that she had a COVID booster with her flu shot together in the fall. Should she wait until the fall to add this pneumococcal pneumonia vaccine?
Absolutely not. She should be able to come to a pharmacy or the doctor's office and get the vaccine. You want to be protected as soon as you want to be, as we can. So please come to the pharmacy or talk to your doctor and get the vaccine.
All right. I think that we have answered most of the questions. We'll ask one more question. Is there any vaccination that is recommended for people in their 40s and their 50s?
So there are vaccines that are recommended. Specifically, the pneumococcal is recommended for those ages 40s and 50s if they have those health conditions, which make them a little bit more vulnerable to having severe disease with the pneumococcal bacteria. And again, those were those chronic diseases that we mentioned. And again, you can talk to your physician or ask me, your MD, and we'll definitely let you know if you're aligned with the vaccine eligibility.
Well, we want to give you all a big hand and thank you so much for sharing this information with us. It has been very helpful. And now we will move into our next panel around the RSV vaccine. So we have another set of phenomenal panelists to walk us through some ins and outs of this vaccine. We have Dr. Cornetta Levi, who is a healthcare supervisor at Walgreens. She earned her Doctor of Pharmacy degree from Drake University College of Pharmacy and Health Sciences, and her Master's of Business Administration from Drake's College of Business and Public Administration in May 2007. She is the healthcare supervisor for Chicago Southwest Area 45 of Walgreens, where she has submerged herself in providing comprehensive healthcare services to her community, focusing on health equity. We have Sonya Collins, who is the pharmacy manager at Walgreens. She has been employed with the Walgreens company for 32 years, and she's presently a pharmacy manager in Temple Terrace, Florida. She was a guest speaker for two presentations at a COVID-19 community event for NCBW. She was recognized by the Tampa chapter of NCBW Inc. as an outstanding influence in the area of health and wellness in May 2023. And again, we're thrilled to welcome back Dr. Patricia Marsh, the CEO and co-founder of Ask Me Your MD Inc. And she's going to provide her expertise on this panel as well. Ladies, welcome, and thank you so much for being here this evening.
Thank you for having us.
Well, we will dive right in because you know our panelists have our participants have lots of questions. So let's talk a little bit about exactly what the RSV virus is and how does it compare to other respiratory illnesses such as COVID-19 and influenza?
So let's talk about RSV, ladies. RSV stands for Respiratory Syncytial Virus. RSV, it's a highly contagious common respiratory virus that for the most just causes mild cold-like symptoms, but for others, it can lead to severe infections for our infants and our older adults. So like the flu, the RSV is a seasonal virus that starts in the fall and it peaks during our winter months. Now, RSV, fluid, and COVID-19 are all classified as respiratory viruses, which means their symptoms are very similar. A nasal swab test will rule in or out each viral infection. A rapid test or a PCR test will actually give you the definitive diagnosis of which viral infection it is. Now let's discuss the symptoms of RSV. Symptoms include runny nose, decreased appetite, coughing, wheezing, fever, sneezing, tiredness, and shortness of breath. And now, if you'd like me to segue to which patient populations are most affected by RSV and why should they get this vaccine?
Yes, Ms. Collins, I was going to ask you that. Tell us which groups are most at risk.
Okay, so annually in adults, this is our new latest statistic, 60,000 to 160,000 hospitalizations and 6,000 to 10,000 deaths in the United States alone or for adults in RSV. So this is the issue. Because of these staggering statistics, this is why we manufactured this vaccine, because this is one too many people dying, one too many people who are getting hospitalized, and most importantly, it puts a serious burden on the healthcare system. And if there's a way that we can prevent this, this is something that is necessary, and that is exactly why we have this introduction of this RSV vaccine.
Thank you. That is very helpful. I don't think a lot of us understood really what RSV was and how it's impacting our communities. Dr. Marsh, tell us how this virus is transmitted and what precautions we can take to kind of prevent this infection.
So it's transmitted in very similar ways to other viruses that we saw. Droplets, again, from sneezing and coughing, any of the mucus that you come into contact with a sick individual that already has RSV. And of course, if you are one of those vulnerable that Dr. Collins spoke about, you're going to have, some more severe and moderate symptoms than the regular person who would just have cold symptoms.
Mm-hmm. So how do you prevent yourself from getting it? I mean, what can we do? Is it similar to these other things that we've talked about?
Yes, I know a lot of people are so tired of hearing this from us, physicians and clinicians, but hand washing, I cannot stress that enough. Washing your hands is the single most action that you could do to protect yourself. Outside, of course, of wearing a mask if the rates of RSV or other viruses is high. But hand washing, making sure you spend those 20 seconds getting your hands very soaped, sudded, and cleaning underneath the nails as well, just to make sure you don't, infect yourself or infect someone else.
Mm-hmm. I think that's really important. And I think that when you think about Ms. Collins's statistics and the most vulnerable populations, those are the ones who are most at risk. Those are the ones we're not seeing a lot of hand washing in those particular groups. So I think that these are habits that we need to start implementing across the board. What are the symptoms? How severe can they become?
Right. So she spoke of some of the symptoms being headache, runny nose, but I'll just add, especially in those individuals who are more vulnerable, we'll see nausea, we'll see vomiting. She spoke about shortness of breath, of course, because it's a lung infection, but you also can get that overall fatigue and just be out for the count. And so we definitely want people to, stay tuned for those symptoms as well, because it might not just look like a cold. It might be a little bit more severe in your body.
We heard Ms. Collins talk a little bit about how we can determine if you actually have RSV. And I was really surprised because you said something that, of course, we're all familiar with, PCR, because of COVID. And so we're used to hearing this term PCR, but we're used to hearing it specifically with COVID. Dr. Marsh, can you expand on that just a little bit and tell us how it's diagnosed and how we can, again, how we can confirm this?
Yeah, absolutely. So the smart scientists that they found out the exact shape of the RSV virus. And they were able to pick out those key proteins or parts of the virus that are able to enter into your healthy lung cells. And what they found was that there are particular ones that we can isolate and teach your body how to prepare antibodies or weapons to literally fight the virus from getting into your lungs and from causing severe disease. And so that's a little bit about how, we found those proteins, but the PCR actually recognizes those proteins that are commonly found in these vaccines that we are asking our community to get to protect themselves. And those specific proteins, we call them antigens. So it'll pick up that protein and say, yes, this is something specific to RSV. This person has an RSV infection.
Thank you. Sonya, can you tell us how we treat RSV and what medications or vaccinations may be effective and how they're available to us?
Absolutely. So there is no specific treatment for RSV. So when patients present to the pharmacy and tell us that they're feeling sick and they tell us that they have RSV, you basically have to treat the symptoms. So naturally, we tell them you have to rest because you have to allow the virus to run its course. And viruses are so virulent and strong, they wipe you out. So that's why you have absolutely no energy. So absolutely rest is your first course of therapy. Next, pain relievers for the fever and body aches because your body aches terribly and you have absolutely no energy. So you want to use Tylenol, like 500 milligrams at least 3 times a day. Ibuprofen, 200 milligrams, which is also an NSAID or an anti-inflammatory. We can also use that. Also, we want to drink plenty of fluids because you want to avoid dehydration. You want to drink water. You want to drink orange juice to help to boost that immune system. And also you want to drink Gatorade to help restore your electrolytes upon dehydration. And also many of our patients experience cough. So for a dry cough, I recommend Delsum. Now for a wet cough, which is a phlegm producing cough, we recommend Mucinex because Mucinex is an expectorant that helps us to cough up phlegm. Now this is something I want everyone to remember. When you have phlegm production, you need to avoid dairy products. No milk, no yogurt, etc., because dairy products exacerbate or make worsen phlegm production, and phlegm is one of the enemies when you have any type of respiratory illness. So you have to avoid that at all costs because it makes it thick and you're wheezing and you're coughing and you're like, oh, I can't stop breathing. It's hard, but that's because you've added milk, and milk is the enemy of any respiratory illness. And lastly, if someone is having sinus congestion and upper respiratory issues, like sinus and congestion, you want to recommend Claritin, which is the antihistamine, which stops the runny nose. You want to do Sudafed, which is decongestant. However, if patients have high blood pressure or thyroid issues, you have to avoid the decongestant because those decongestants can run up your blood pressure. So you want to stick with plain Claritin. And lastly, you would want to do a nasal saline and suction to help to clear those nasal passages. Now, I am so happy and proud to say that there are now 2 vaccines that have been recently approved by the FDA, amen, for the prevention of RSV and infections for adults 60 years of age and older. The first one is called Abrevzo, which is manufactured by Pfizer, the same manufacturer of COVID-19. And the next one is called Arexvy, manufactured by GSK. Both of these vaccines will be released in September of 2023, which is perfect timing for our fall season, because that's when the seasonal virus is going to start in peak. And you know what, you guys? We're going to protect ourselves and get those antibodies going because we don't need to get sick, because now we're informed why. We know that only antibodies are our only powerful stop to be able to prevent the spread and to not make us sick from RSV.
You know, you have said quite a bit there, but so which takes me back to say, make sure you utilize your neighborhood pharmacist, because the things that Ms. Sonya Collins said are really important for us to know what kind of medications to take, depending on what kind of health issues we have or what kind of cough we have. Is it productive? Is it phlegm producing? So I think it's important to make sure that you are really talking to your pharmacist so that you're getting the right kind of medication to treat the symptoms that you have. And we appreciate you telling us that, yay, there's vaccines coming. Tell us a little bit about what they are, what these RSV vaccines are, and how they work.
Okay, so Abrevzo and Arexvy are not live vaccines. And what this means is that the patients will not have as many side effects. So if you have a live vaccine, patients tend to get more side effects because they actually contain parts of the virus. So let me explain how the vaccine really works. The vaccine induces an immune response against these proteins are called pre-F and pre-F3 and RSV. So this protein is used by the virus and it attaches itself to the human cell and it infects people. But allow me just to simplify this. So the mission of the virus is it seeks to destroy and wreak havoc on your lower respiratory tract. So it's causing bronchitis, bronchiolitis, pneumonia, and even death. Now, the vaccine induces an immune response, as we've all said, to make your body form antibodies against RSV. These antibodies, it's your body's armor, it's your body's protection, and it is the way you fight. That's your inner portion fighting to be able to protect you. So when you have the cell, you have all of these antibodies around your cell. So that RSV vaccine tries to penetrate that cell, you have the armor, your protective warriors called antibodies that's around that cell, and it cannot penetrate because you've taken care of your internal body by having those antibodies. And listen, ladies, there is only one way to get antibodies, and that's only by getting the vaccine. So in essence, without the vaccine, you're totally defenseless against RSV. But the vaccine is the only way and the best way to give your body a fighting chance to protect you and your family from RSV.
Okay, we know now that we need to get this RSV vaccine so that we can protect ourselves against this terrible virus. Now, Dr. Levi, please tell us how effective this RSV vaccine will be in preventing the infection.
So there, like she said before, there are two different vaccines. So Abrevos, their overall effectiveness is 85.7%, but we're talking about an highly infectious disease. So this is someone who we've been talking about all day, someone who has diabetes, someone who has pneumonia already on top of this. These are patients who are already sick, and now we have compounded on top of it with RSV. So with that vaccine, you're looking at 85, 86%. So then with Arexvy, which is the GSK GlaxoSmithKline, they have kind of two different effectiveness. So when it comes to overall effectiveness, so severe, moderate, and intermediate, there are 82.6%. However, in lower respiratory tract infection for severe, like stage 2, their effectiveness goes up to 97%. So for people who already have, who are non-compliant with their diabetes, meaning they walk around with a sugar of 300. There's probably some people like this on this call. We talk about you. And then also think about your bad asthmatics. You think about the people who are smokers, and then they'll say, oh, I only smoke with 2 packs a day. Well, 2 packs is a lot. Well, I came down from 4 packs. Well, thank you, congratulations, but you will still fit in this category. So that's why it's so important when these vaccines come out, and it's probably going to come out in September because it has been approved. ACAP has approved it as well. So now we're just waiting for all the other red tape and stuff to come out so we can actually get it in stores and in doctor's office. And I believe they're aiming for September, which would be great. And really looking at everyone who's at that 60 and up. Everybody needs to be vaccinated in that age group.
Okay, so you said that everybody 60 and up needs to be vaccinated. 60.
As soon as it comes out, yes, ma'am.
As soon as it comes out. So September, we should see this mad rush to the pharmacy and these long lines because we need to get that.
If you make an appointment, you won't be in a long line. You make an appointment. Make an
appointment. So we don't have lines and we don't stress our pharmacists out trying to make sure that they're able to give us all these vaccines because we will be there to get vaccines. Is there anyone else eligible to get this vaccine?
So right now it's only approved for 60 and up.
Okay. Okay. So only the 60 and up crowd.
Correct.
We need to be there. All right. Dr. Levi, tell us what is the safety of these RSV vaccines and the potential side effects? You know, I know we're going to get a lot of questions in the chat. I think they're already coming. Long-term effects, side effects. How often do we have to get them? Could you give us a little bit of information about that?
Sure. So the side effects is pretty much the same as the pneumonia vaccine. You're going to get soreness at the injection site. So there's a tip. Everyone loves to get it in their non-writing hand. So always get it in your dominant hand because it goes into the muscle. So if you are not moving that arm, it's going to be tight and sore the next day. So I always tell people to get it in their dominant arm because they're moving it. Or if, lift some cans, get some dumbbells, move and stretch that muscle. So now that vaccine has dispersed within that muscle and is not sitting in a knot. So that's where that soreness comes from. And then you're going to feel that you might get a little redness there, and then you might get a fever. Same thing. Make sure you take some Tylenol before or some Benadryl just to wear off those side effects. For more than that, that's the only thing that we have seen within the clinical trials that is site reaction and fever. And the muscle ache afterwards.
Before I ask you the next question, I do want to touch on what you just said. That's what you've seen in the clinical trials. I think that's important for our listeners to hear because there will be somebody invariably who will hear something. I know this audience will never do that, but one of their friends, family, colleagues, somebody on the street will say, nobody's tested it. It's just come out of the world. They moved it too fast. These vaccines have gone through many, many, many years of trials on people that look like you and me to check their effectiveness, correct?
Correct. And then on that same subject of clinical trials, both of these companies made sure that they had a wide selection of people in clinical trials. So people who look like you and me were in the clinical trials. But once again, it is important for us to join clinical trials so we can make sure that it is effective and it works the same in us, because we keep letting others be in clinical trials and then expect it to work the same. We have different mechanisms of action when it comes to certain medications. This is another reason why we need to be joined in these clinical trials. So if you never heard of an organization called All of Us, that's one of a great organization to actually get with, because they hold a database for people of color for these clinical trials, because we're not going to know how it affects us as a people if we are not participating in clinical trials.
Very important point to note. So thank you for that. I appreciate that. So now tell us again when this vaccine is going to be available.
This should be out in September. We're trying to see if we can get it by end of August, but definitely mid-September it will be here.
Do we know how long the protection from this vaccine will last?
Right now, it's recommended for 60 and older one time. That is for right now. But once post clinical trial data comes up, so when we say post, so once it's out in the market, those companies are still collecting data. So we report incidents, anything like that, to MedWatch, and all of that gets collected. So then they can tell if we need to do another shot, if the CDC will look at it. Same thing with ACIP will look at it again to see if it needs to be recommended. So once again, I need everyone to get the shot, because we don't know once it goes to the masses, because you'll have those one-offs, and we need to make sure we know that.
It's a dynamic process. We saw that with COVID. And I think that's important, that it is a dynamic process. And as Dr. Levi said, get the vaccine, and that gives us more information on how it's going to impact us. So we don't know how, we have some data on how long we should take it at this point, over 60 a year, and then there'll be some reevaluations. What will impact the availability of the RSV vaccine on public health? What impact will the availability of the RSV vaccine have on public health and reducing the burden of RSV infections, Dr. Levi?
So the impact is if that group of population, and all is reaching for the sky. I like to reach for the sky, but I am very realistic. If we get 25% of that age group to actually get vaccinated, we will see at least a 3/4 turn and low emission rates. Don't you agree, Dr. Marshall?
I absolutely agree. And we should throw it out there. We're seeing more Black individuals being hospitalized from RSV, which is why our community really, truly needs this.
And I think things like this is important, because there is that vaccine hesitancy. I understand. So we still had the whole drama with COVID, why people didn't want to do it. It was so politicized. This is not politicized. This is a health issue. It's just about your health. We need to actually get vaccinated.
And it's important.
Can I add one point to adjunct to that? So the most important thing with this target audience is African Americans. So as African Americans, you guys, we are predisposed to be infected by respiratory illnesses like COVID and like RSV, because as youngsters, you guys, how many of our young Black children have asthma, COPD, breathing issues, eczema, which is also an adjunct to, it's an allergy of the skin. Because we are exposed to these things like high blood pressure and heart disease at a younger age, when we are infected with these types of viruses, it hits us a lot harder. And so we are the ones who are hospitalized, and statistics show that with COVID, we were the ones who were dying far more than our Caucasian and Asian counterparts than anyone else. So even though our African-American people are probably one of the main populations that have vaccine hesitancy, we are the population that needs to get it, because we are the ones who are dying in larger numbers in comparison to our other counterparts. So vaccine hesitancy should not be an issue. It's something that's imperative for us to be able to live life, to live well, and to protect ourselves. And you come to your wonderful world of Walgreens, especially in Temple Terrace. I'm going to talk to you, explain the what and the why, so that you can get your vaccination and feel comfortable, and to know that I look just like you. I'm vaccinated, I'm healthy. These ladies look like you. Dr. Marsh, go to her office and she will explain to you why you need to get all of these vaccines, pneumonia and RSV, to be able to help live a happier and healthier life.
I think we just need to bundle them up and get them all at the same time. We are living. And so I need all of my fabulous 60 counterparts to make sure that we set our little calendars for September 2023 so we can get down there and get this particular vaccination. And so we have gotten some really invaluable information tonight. So let's take some time for a few questions that we have about this particular vaccine. So first and foremost, I think you've answered the fact that we don't know if RSV will be an annual vaccine because we know we need to take it for this year, but you're going to do some reevaluating to determine if it needs to, if we need to get updated vaccinations. Are these vaccines good for people who have MS?
Oh, absolutely. I'll take that. So there are clinical trials going on in certain higher risk individuals. MS, definitely because of the medicines that you have to be on, they're put in that immunocompromised group. And so, yes, this would be one that we recommend for those patients, as well as pregnant women. So we have a lot of newborns and premature babies who die from RSV. A lot of Black babies, you all, are dying from this infection. And so we're seeing in the clinical trials that we're able to give the mothers the vaccine and they're able to help their children fight RSV no matter when they're born. And those numbers look very similar to those that we've seen in older adults, but as well, you know, they're going to be determining if it's an annual thing or if it's something, you know, that is just a one and done.
What are there any targeted campaigns to address the chronic conditions and facilitating people to get this RSV vaccination?
Well, right now, until they got full approval, you're not going to see as much advertising. Once they're to market, fully approved in stores, that's when you're going to see the advertisement, because it makes sense, because we are procrastinators, and if I tell you something too early, you're not going to remember it. So we need to get it to you when it's hot and heavy, and you can go and get it right then and there.
Okay. Now, one of the things that we talked about was, you know, some of the symptoms and what we should and should not be taking, and what we should and should not be eating and putting in our system. But let's talk a little bit about babies. You talked about, Sonya, you talked about certain kinds of symptoms and coughs. You should not use dairy with these respiratory illnesses. How does that impact babies who are breastfeeding or formula feeding? Is that only for cow's milk? And if so, what do we do around that?
But basically, it's probably for cow's milk, because I don't have any information that's about that. But from what I've studied, because I had a child that had RSV, and that was what they told me to avoid, it's cow's milk, because it is homogeneous, it's manufactured. That thickness is the thing that when it gets into the bronchioles, it makes that phlegm get so thick, and it helps to close off those bronchioles. And in those patients, those babies that I've seen, when their bronchioles close, they actually have to use albuterol, which is a bronchodilator. And I've seen tiny little babies have to be on breathing treatments because their little phlegm is so hard. And remember, babies can't blow and evacuate their noses, so they're stuffy and they can't breathe. And initially, when we all think of RSV, we all think of it as a baby type of virus. So let me let you guys know that the reason why we're coming out with this vaccine is because in hospitalizations, patients were presenting with flu-like symptoms. They would test them. It's not flu and it's not COVID, undocumented cases of RSV in adults. And this is something that we've never heard of actually until this year, that there were so many undocumented cases, hence, which is why they had to create the vaccine. But with those poor children, because their mothers can still give breast milk, but regular cow's milk, whole milk is like the enemy when you have any type of phlegm production. So you want to stick with water, because water is a natural mucolytic, which means that it gets into the bronchioles and it breaks it up and it thins it out. And if it thins out, then you can cough it up. So when you have a productive cough, that's exactly what you want to do. You don't want to suppress the cough. You want to thin out the mucus and you want to cough it up, because when you cough it up, you have to get rid of the infection. If it sits there, that's how it turns to bronchitis, bronchiolitis, and more importantly, it turns to pneumonia. That's what we're preventing with decreasing milk production.
Any contraindications around this vaccine and our friends and family members who are diabetic, who are on insulin, anything we should be concerned about with that?
Right now, there's no contraindications. There's no black box warning on the vaccine as of this moment. So no, not even with warfarin.
Okay, saw that. All right, we got it. Okay. I think we have answered all of the burning questions from our participants who have joined. And I want to thank all of you. I think we've captured everything. We've talked about the side effects. You told us that, they're not any that you see. There was another shout out in the chat. Thank you so much for clinical trials. Please, 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 you all go get into clinical trials. They're really important to be able to tell our story through the medications and the preventives that are being developed. So please do that. I just want to thank this amazing panel. Thank you, ladies, so much for this phenomenal information. I want to thank our previous amazing panel for that information. I think we're armed and ready. We are going to be getting our vaccines. We know how to protect ourselves. And at this point, I am going to turn the program back over to Executive Director and past President Virginia Harris.
Thank you. What amazing information you have provided to us. So as we get ready to close and reflect on the information we just heard on the respiratory season and how to protect ourselves and our family, it is up to us to continue the conversation. Vaccinations are recommended for all children under the age of 5 years old and adults 60 years and older with certain health conditions. As we continue to advocate for our communities, we must continue to advocate for our health and the safety as well. So I'd like to thank Walgreens corporate team, Madam President Jones, facilitator Dr. Kimberly, Leonard, our amazing panelists, Simy Casasola, Dr. Patricia Marsh, Danielle Nwigwe, Dr. Cornetta, Levi, and Sonya Collins, for sharing some important information that we all need to hear before the fall season. Special thanks to Nicole Wade, Afrida Stoops, Bridget Baker and her team, NCBW members and guests. Have a wonderful evening.